Hello, my name is Stefan Voo and I am a nuclear medicine physician at the Institute of Nuclear Medicine, University College London Hospital and Whittington Hospital in North London. It is a great pleasure to be here and present our evolving experience with artificial intelligence and machine learning in bone mineral density and osteoporosis assessment. In our aging society, osteoporosis and its clinical outcome, fragility fracture, have become a growing social issue in both medical and economic aspects. According to current statistics, 40 to 50% of women compared to about 20% of men aged 50 plus will suffer an osteoporotic related fracture within their lifetime. As we have learned today, the diagnosis of osteoporosis is based on assessing bone mineral density (BMD) using a DEXA. In addition to BMD, the fracture risk assessment tool, FRAX, incorporating additional clinical risk factors, is a well-validated and widely used tool for fracture prediction. However, despite these gold standard diagnostic tools, we'll still talk about 200 million women worldwide being affected by osteoporosis, and that osteoporosis causes nearly 9 million fractures annually. Therefore, I guess there is an unmet need for tools with easier accessibility, which can be widely used for screening of osteoporosis. Machine learning methodologies are rapidly implemented in various medical fields, and this includes bone and bone mineral research. It is interesting to see that there has been a progressive increase in the number of articles published on machine learning in bone and bone mineral research in the last years. While in 2020 there were about 100 articles published on this topic, in 2022 the number of articles has doubled, and in 2024 there were more than 4 times more articles published than 4 years ago, and the total number of articles reached about 420 articles on the field of AI in bone density. Interestingly, only in the last 2 months of this year, there are already more than 100 articles on machine learning and BMD. A majority of the studies focused on screening for osteoporosis or detecting fractures, probably due to the relatively easier access to validation data. But there are also new, more sophisticated deep learning tools or softwares which look at additional risk factors employed in predicting the risk for fractures. Many researchers have focused their attention on developing practical screening tools for osteoporosis using AI methodology. So the idea behind is to extract the bone mineral density BMD information from various routine standard of care scans such as X-ray or CTs. So how does it work? To create the training dataset, the virtual X-ray image of the bone region that was precisely aligned with the patient's X-ray image was first reconstructed using original quantitative CT scans from patients. Subsequently, 3 training steps were performed to develop the final BMD estimation model. In the first and second stages, X-ray images were decomposed into the virtual X-ray image of the bone region. In the third stage, the model learned the correlations between the virtual X-ray images and BMD values based on the training dataset. And as a result, the system could estimate BMD using a single X-ray image. It is important to mention that there is already a clinical trial running at the RNOH, funded by Innovate UK's Precision Medicine Programme. As I have already mentioned, the idea behind is that the AI technology will extract the BMD values from routine X-rays that are being carried out for other reasons. For example, someone referred simply for hip pain. So practically, the AI technology will try actually to mimic the gold standard test for detecting osteoporosis, a DEXA scan, using, in this case, only a standard X-ray. The benefits of this include doing more with less, one would say. The X-ray is already being done, but this added information can capture people who might not have been otherwise screened for osteoporosis. Thus, having such an AI tool could help prevent or reduce the number of patients who would get fragility fractures on osteoporotic bone. With regard to screening for fractures, there are already many studies which have reported on the application of machine learning in fracture detection, and some of them have become the basis for commercially available programs which are already used in the clinical setting, in instance for the detection of wrist or vertebral fractures. There is, however, room for improvement. The paper of Bagdelay, for instance, showed that the AI algorithms used to detect hip fractures, in instance, or have a poor detectability. The true positive cases were detected based on clinical variables rather than imaging features. And then there is a need for appropriate validation of the AI tools. Now, in terms of predicting fractures, most studies use large databases to build prediction models. Using standard machine learning methods and regression trees, for instance, the CAT-BOOST model has shown that in postmenopausal women, the top predicting factors are total hip, lumbar spine, and femoral neck BMD. Well, quite unsurprisingly, followed by subjective arthralgia score, serum creatinine, and homocysteine level. Should this be included in the standard FRAX score? Well, maybe. Although BMD measured by DEXA is a major determinant of bone strength and fracture risk, it is well known that over 50% of fractures occur in patients with DEXA values that are not classified as osteoporotic. In this figure, the green columns show the rate of fractures occurring in women, and as we can see, the highest number of fractures occur at T-scores between -1.5 and -2.0, which are in the low bone density range rather than osteoporosis. This means that other factors than BMD influence bone strength and fracture risk, and this include the bone microarchitecture, for instance, or bone geometry, bone turnover, etc. The Trabecular Bone Score (TBS) software is a successful story. This is a relatively new technology using deep learning algorithms, which is increasingly installed and used on current DEXA scanners. How does it work? TBS is a texture index that evaluates pixel gray level variations in the lumbar spine DEXA images, providing thus an indirect yet highly correlated evaluation of trabecular microarchitecture. The TBS principle could be compared to an aerial view of a forest. We cannot discern individual elements of that forest, for instance trees, or on a DEXA image, one cannot discern individual bone trabeculae. But the software can easily identify the areas of missing bone in the trabecular compartment, or, if you want, clearings in the forest. Is TBS important? Well, yes. Tested on more than 75,000 patients, TBS seems to be an additional tool to identify patients at risk. For instance, in the image on the right, there are two patients with similar BMD values. However, using the TBS algorithm, we detect a poor microarchitecture in lumbar spine vertebrae in the second patient compared to the first one, indicating that the patient is at risk of osteoporotic bone and osteoporotic fracture. So, in summary, machine learning models for diagnosing and classifying osteoporosis and detecting fractures from images have shown promising performance and have improved over time. Fracture risk prediction is another promising field of research, and studies are being conducted using various data sources. However, despite the enthusiasm about the use of AI for medicine, there is still need for appropriate validation of these algorithms. So, to conclude, there is promise in the field of AI in bone disorders. All eyes on the new AI and deep learning technologies for the diagnosis of osteoporosis and identification of fracture risk. Thank you.